Well, good afternoon. Yesterday, I ordered the Canadian Armed Forces report to be made public, and that report was heartbreaking. I appreciate the great work of the Canadian Forces in our long-term care homes, and I'm grateful that they have now agreed to stay on until at least June the 12th. I'll not shy away from the horrors we found. Everyone deserved to see what was happening, because it's the only way we'll be able to bring these issues to light. That there can be accountability, that there can be justice. And as soon as we received this report on Monday, we launched a full investigation. And the results of our investigation will be turned over to the police. And now we're taking further steps to protect our most vulnerable. Effective immediately, we have begun the process of taking over management of 5 additional homes in the system that we are currently most concerned about. Those are Eatonville Care in Etobicoke, Hawthorne Place in North York, Altamount Care in Scarborough, Orchard Villa in Pickering, and Camilla Care in Mississauga. We've already taken over 2 homes because we had concerns, and now we're moving to take over these 5 homes, because in the face of those accusations, in the face of these problems, we'll use every tool at our disposal. And that means staying on top of the situation in these homes. We need boots on the ground. I want eyes and ears in the homes that we're most worried about, keeping a close watch. We're deploying 6 teams of 2 inspectors to each of the 5 homes highlighted in the Armed Forces report, as well as the Camilla Care home in Mississauga. They will undertake an expanded and rigorous inspection and monitoring of these homes for a period of 2 weeks. At least one of these inspectors will stay at their assigned home over that entire period to watch over our residents there. They will conduct in-depth interviews with staff and residents, review charts and records, and report back with their findings. Over the next 21 days, we will also conduct further inspections, extremely rigorous inspections of the 13 other homes that are facing the greatest challenges in managing the outbreak. 8 of these inspections have already been completed. And over the next 30 days, I've asked the Ministry of Long-Term Care to conduct random spot checks, both of high-risk homes and other homes across the province. The reality is, these problems are isolated. What we saw yesterday is the worst of the worst. And let me be clear, we're looking at all options. We're fully prepared to take over more homes if necessary. We are fully prepared to pull licenses, to shut down facilities if it is necessary. We will do whatever it takes for as long as it takes. And that is why today I'm ordering officials to expedite the establishment of an independent commission similar to the SARS Commission. The public service is currently taking the necessary steps to get the independent commission established in July. We will establish an open, transparent, and independent commission. We will get to the bottom of this as quickly as possible. The commission will be independent of the government. It will be open and transparent. There'll be public hearings. They will call witnesses. The reports will be made public, and we'll get answers, because our seniors deserve nothing less. Their families deserve nothing less. They deserve answers, and we will deliver them. There will be an independent commission. The Auditor General is investigating. The coroner is investigating, and possibly the police. No stone will be left unturned. My friends, as a country, as a province, we have a duty. We have a responsibility to protect those who cannot protect themselves, and we cannot do it alone. We need the Prime Minister's help to fix this problem, because no province can do this alone. My friends, I will continue to do everything in my power, because We're talking about someone's parent, someone's grandparent, someone who built this country in this province. That's worth more than anything in the world. And that's who I'm going to keep fighting for each and every day. Thank you, and God bless the people of Ontario.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up. First question.
First question comes from Colin DeMello from CTV News. Please go ahead.
Hi, good afternoon, Premier. So talking about the independent commission that's beginning in July, will that commission have the power to investigate your own government's response and handling of the COVID-19 crisis, and will you yourself appear as a witness if called?
Absolutely, I'd appear, and they have the full authority to investigate our government, my office, the ministry's office, because I'm going to tell you why, Colin. We want this to happen. We have been working 24/7 around the clock. I have two incredible ministers that are doing everything they can to fix a problem that we inherited decades of neglect, and we're going to fix the problem. That's our job, but I want it fully transparent right from the get-go, and be called as a witness. 100% I'll be a witness.
Thank you for that, Premier. And, you know, of course, change is difficult when you have the same people in place who are overlooking the system. The NDP and critics are calling for the firing of your Minister of Long-Term Care. Are you going to fire your Minister of Long-Term Care, or are you looking for any sort of resignations as a result of that report?
You know, absolutely not. I stand behind my minister 100%. This is, when it comes to long-term care, it's probably the most knowledgeable person down here at Queen's Park, no matter what party it's from. Dr. Fullerton spent 30 years working in and out of the system, working at long-term care. There's no one that stays up more at nighttime, that is worried about the patients, that is pushing the table every single day. And I count my blessings that I have Dr. Fullerton as a minister and Minister Christine Elliott as health. I couldn't ask for two better people. And just to have someone be accountable and the heads roll, no, it doesn't work that way. The heads should have been rolling for decades down here, and they weren't rolling. And we're going to fix this problem.
Next question.
Next question comes from Ryan Tumilty from National Post. Please go ahead.
Yeah, good morning, Premier. The 5 homes that were identified yesterday, the companies that own those homes combined own 88 other homes in the province. I'm wondering if you're going to step up inspections of the other homes that those companies own.
We're going to be stepping up in inspections. Good question. We're going to step up inspections, first of all, at the 19 homes that are in red. We've already done 8 of them, but we're going to do surprise inspections right across the province. So, you know, my message to all long-term care homes, get your act together. And I'm not going to paint a broad brush. Again, I mentioned this yesterday. There's 626 homes. I think close to 80% haven't been infected. We have incredible people that are sacrificing themselves every single day going into these homes, helping people. You know, we had a bad situation on a few of these homes, but we're going to be checking every single home over a certain period. As the minister said yesterday, we did over 3,000 inspections over the last year, but these are going to be rigorous inspections. We're going to check every single detail in that home. But I just want to thank, again, I want to make sure I thank the frontline healthcare workers that are going in there day after day. Because of this happened, I don't want the message out there that they aren't doing their jobs. They're working their backs off. They're sacrificing their families. They're putting themselves ahead of, the community ahead of themselves. They're putting, in a lot of cases, they're putting themselves ahead of their family. They're coming home after a long day's work. And, you know, they don't even know at the time if they come home one evening if they have COVID. As far as I'm concerned, they're incredible people. And just because a small percentage we had problems with, this is not representative of the frontline healthcare workers that I've met and I've seen. I just want to thank them for doing an incredible job keep doing an incredible job. Because of them, 80% of the homes are safe because of the work they have done. So I want to thank them and the operators of the homes that have done an incredible job.
Follow up?
Yeah, Premier, the report yesterday, these companies, like I said, they manage dozens of other homes in the province, and the report sort of identified systemic issues, a lack of staffing, a lack of resources, a lack of training. I'm wondering what confidence you have to have these companies operating dozens of other homes, given how they operated these facilities.
Well, we're going to be inspecting all those homes right across the board. We're going to do rigorous inspections, and we're going to find out very clearly and very quickly who are good operators and who are bad actors. And I can tell you there's more good operators than there are bad actors. But it's been pretty apparent that those 5 homes, it was terrible, absolutely terrible. One of them put a lot of corrections in place, and we thank them. It's Holland Christian. They came out in the green area. So there's 3 areas. There's the green that are good, yellow, and then there's obviously the red. And the red ones we're concerned about. And we're going to do everything we can to make sure we get all those red ones back into the green area.
Next question.
Next question comes from Christine Elliott from CP24. Please go ahead.
Hi, Premier. I recognize that you mentioned here that you won't hesitate to pull licenses.
Yes.
But what I'm wondering is, will you commit to remove the licenses from the owners of these 5 homes in the CAF report that are noted in the report, as opposed to simply ensuring these homes return to compliance? I'll use the example of Orchard Villa. It's the province's hardest hit home. This home has a history of documented violations before COVID-19. So what good is it to say, we'll get you to return to compliance if a home continues to violate the rules time and time again? So the question is, will you commit to removing the licenses of these homes?
Well, Christine, I won't hesitate to pull any license, but I want the inspectors to go in there, and I want to see if they've corrected the problems that the Canadian Armed Forces put out into their report. And the other area, not to get into the weeds at all, but a lot of these homes own the buildings as well. But I won't hesitate to take the long-term care patients out of those homes and put them in another home or in the hospital if we have to. But I really want them to have their corrective actions in place and be a good operator. I don't think it's too hard. When you have the vast majority of these homes that are good operators, I don't know why these are so bad. It's poor management, in my opinion. It starts at the top.
And Premier, the families of these victims who are alleged victims of abuse and neglect, have the families been notified that their loved one may be a victim of abuse and neglect?
I would have to talk to the long-term care folks about that. I have not personally called them. I know our local MPPs, Orchard Villa. I know Peter Bethenfalvey, President of the Treasury. He's been in touch with quite a few of the families out there, and I'll have to touch base with the other local MPPs.
Next question.
Next question comes from Julianne Lamoureux from Radio Canada. Please go ahead.
Good afternoon, Premier. Many times during this pandemic, you've called on the federal government to help fix what you call the broken system. If the Trudeau government was to launch a national inquiry into long-term care homes, would you welcome that, or would you see that as your provincial jurisdiction, and would you have a problem with that?
Well, I'd like to sit down with the federal government, and I need them at the table. We need their support. We need their financial support, to be very blunt. But this is what we're doing. We're going to have a very transparent and open, independent commission. We're going to have the Auditor General go in and do a report. We have the coroner's report and possibly a police report. So believe me, there's going to be no stone unturned. When we have the auditor, we have the coroner, we have the police, we have an independent commission, I'll tell you, there won't be a piece of dust on the floor that they aren't going to be inspecting. And I want that. I want that to happen.
In Quebec, Premier, it's the province's ombudsman that is in charge of the independent inquiry into COVID-19 crisis in long-term care homes. You haven't filled the patient ombudsman post since taking office in 2018. Do you regret not doing so?
No, I don't regret it, because we're going to have a strong independent commission that will be able to go in and get the answers for us. We have everything from the report from the Canadian Armed Forces, again, through the Auditor General, through the Coroner's Office, through the police, through an independent commission. I think we're going to cover every corner of long-term care. But the most important is we're going to fix the problem. After decades of neglect, from all different parties, by the way, of decades of neglect, we're going to fix the problem. And we need the support of everyone to fix the problem, including the federal government.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Premier, so you've announced these new inspections to happen in long-term care homes. I think a lot of people are wondering, given that the pandemic's been going on for a couple of months, why weren't proper inspections actually happening in long-term care homes at the time? We even, broke a story about how long-term care inspections were done over the phone by government inspectors. Can you explain why it is that these things weren't happening until now?
Yeah, Mike, I'll pass that over to the Minister of Long-Term Care.
Thanks, Mike, for the question. I think it's really important to clarify about the inspections. So there were dozens of inspections done in these homes over the course of since June of 2018. Thousands, almost 3,000 inspections done on all our 626 long-term care homes, including, in addition to that, annual inspections of the homes and the RQIs. And I know early on the media really went on those the number 9 for the RQIs. That is a red herring. The inspections have been done. We've had numerous people in there, including public health officials, doing risk assessments, infection prevention and control teams from the hospitals that we've integrated the homes with, rapid response teams, SWAT-like teams from hospitals, and additional staff, and including the military. What we do know is the homes that get in COVID positive situations can spiral out of control very quickly. And so that's partly due to the staffing shortage that was pre-existing before COVID and amplified by COVID. The inspections, if you did them every 5 minutes, it wouldn't have changed the crises in staffing in our long-term care homes. Do we need to have more rigorous inspections of these homes that are staying in the red and the top 5? Absolutely. And you've heard the Premier say that. And you've also heard him say 80% of our homes have been doing well, and we've had resolutions of outbreaks. So the inspections that was started early by some of the media and reporters is not the issue. It's long-standing issues surrounding wardrooms, surrounding congestion in our homes, the person-to-person spread of COVID-19, the asymptomatic spread of COVID-19, and the structural issues in our long-term care homes and the staffing issues. And so the inspections are a critical piece. And obviously, we need to be doing more right now and make sure that there's confidence that that is happening. But the inspections being the cause of this, it's not accurate.
My follow-up's for the Premier. Premier, there's more and more evidence that what's happening right now with the COVID-19 pandemic is significant differences in infection rates in different parts of the province. Given that two premiers who you respect, Premier Legault in Quebec and Premier Kenney in Alberta, have found ways that they could lift restrictions in the parts of their provinces that are not as badly affected as the cities, I don't understand why it is that you can't figure out a way to lift restrictions in the parts of Ontario where they have very, very few active cases of COVID-19.
Well, before I hand it to the Minister of Health, I want to point out a couple areas. Section 22 of the Health Act every single local chief medical officer of health can empower themselves to close their area, similar to the one chief medical officer of health up in the cottage country, saying that they didn't want cottagers up there. So I think it's really up to the 34 chief medical officers of health. But what I would recommend is, Mike, like people travel. Cottage country can see on a long weekend, 500,000 cottagers go up to cottage country, coming from the city, coming from the GTA. I always say we need to stick together. We need to work together as a province, and I think we're moving along fairly well. Everyone's everyone's listening. Everyone's following the protocol of their local chief medical officer. People are still self-distancing. We're ramping up testing, as you saw the numbers, and thank goodness. I know they're up and down like a yo-yo, Mike, but last 2 days have been positive. They've been under 300. So there's positive things happening, and I give all the credit to the 14.5 million people of Ontario. They're cooperating. So why make a big divide now when we're getting through this? And I'm going to pass it over to the Minister of Health. Thank you.
Well, our Chief Medical Officer of Health has helped us, guide us to get to stage 1 in the opening up of our economy with his guidance and his knowledge of our public health system. But there are also local medical officers of health across Ontario who take their own view of things based on their own local conditions. And they can then decide whether they want to open things up to the full extent allowed by stage 1, or if they choose to move more slowly. We're still receiving information from them. We're listening to what they're telling us. That's all going forward to the Chief Medical Officer of Health and the public health officers at the command table. And that will help guide us to stage 2, both in terms of what could be included in stage 2 in terms of opening up of businesses and organizations, but also when to do that. So the regional information is very important, and the local medical officers of health can also make their own decisions based on their own specific conditions within their geographic area.
Next question.
Next question comes from Randy Rath from Sage News. Please go ahead.
Hi,
Randy.
My question is for Minister Fullerton.
Yep.
We talked to PSW today, and she told us that for years she has been documenting circumstances of abuse and neglect and reporting them to the Ministry of Health. And then when your ministry was created, she started reporting them to your ministry. It took your ministry over a year to get back to her. And could you explain to me why it would take that long for a frontline worker to be responded to when she has clearly documented cases that she wants to report?
I would need to know the details of that specific case, but I can tell you that in terms of the action line, the investigation line, those incidents that are reported to us are reported and acted on, and usually within 24 to 48 hours. So something is I need more information on that particular, and I'll go back to my ministry officials and ask them about that specific case. But this is not how it is processed. Our action line and family support line is there for people who have concerns. It's there for staff who has concerns, and that is the process. And we've had an increased number of incidents, to be absolutely transparent, reported, and our inspectors are busy responding to that. We have 175 long-term care inspectors. I want to go back as well, to the history surrounding these inspections. Back in 2016, under the previous government, related to the Auditor General's report, that's why there was a move away from the RQIs. That's why there was a move to the focus on, the more precise incident reporting and inspections. That's how it changed. Our government was on the receiving of that end of that when we came in, but that RQI change was created and initiated by the previous government and under the Auditor General's report. So our inspections are rigorous, they're extensive, they're frequent, and in this particular case, I have to tell anyone who has got a concern that action line is there, and I will go back to the ministry and find out any details on that situation.
Okay, thank you. My next question is for the Premier. Premier, isn't the bottom line in all of this money? Should we as a society be willing to spend more to look after our elderly, our most vulnerable citizens? Isn't it time to stop profit taking? Isn't it time to spend more money per person? Shouldn't we be willing to do that as a society?
Absolutely, especially if it's your mother, your father in long-term care, 100%. But really feasibly, we need the federal government. There's no province in this country, Randy, that can do it alone. We need the federal government. We need their support, their financial support. And let me tell you, I don't think there's a day that goes by that I'm not up here saying what a great job that Chrystia Freeland and the Prime Minister are doing. I appreciate their concern. They're on the phone all the time, asking me how can they help. And what we need help right now, we need help with long-term care. We have a massive province. We have close to 78,000 residents, and as the baby boomers, as young guys like you and I, another 10, 15, 20 years, they start rolling into long-term care. We need to start building capacity and start building it now. We can't wait. Everything we need to do is now, and that's why I've been very decisive. This is what we're doing. This is where we're moving, and we're going to get it done. And if we got to break down that brick wall to get it done, we'll break down that brick wall to get it done. But I want to be very clear and very decisive, and that's what we're doing.
Last question.
Last question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. Back to the inspections. You've talked about the thousands of inspections that have happened. Your minister just called them rigorous. How can the public have any faith at all in this inspection system when obviously it failed to catch the horrific conditions that we saw yesterday in the report?
Yeah, no, I fully understand, and I think the game has changed since COVID has come around. We're going to continue doing rigorous inspections, a lot more rigorous, I guess, in the past, and we're going to continue doing that. But we have everyone from the Canadian military going in to public health going in, Ontario Health. We have the hospitals going in. We're taking over these long-term care facilities. We're doing everything, and anyone available that's out there, we're going to bring them in to make sure we straighten out the problem and get it done like ASAP. Absolutely ASAP. I mean, you can't, I always say, Laura, you can't manage anything unless you measure it. And we're going to be measuring absolutely everything in these homes. Before COVID, yes, the minister was doing an incredible job moving forward on changing the long-term care system, building more long-term care homes. But now our focus is obviously on the COVID-19.
And my next question is for the Minister, Minister Fullerton. Regarding the 5 homes in the report yesterday, can you please explain when these homes were last inspected by long-term care, and were they done in person or by phone? And it's very important that that last piece is answered, please.
So I think, let me address the last piece first. So it was the Ministry of Labour that was doing inspections by phone initially, and some of those obstacles, let's say, were due to understanding how COVID spreads, how COVID moves, and the risks even to the inspectors. So let's be clear about that piece. The inspectors from our long-term care inspectors from our long-term care ministry, there have been dozens of inspections in these homes since June of 2018. Our long-term care inspectors have been in contact with the homes, the touch point for homes in distress who need support. And as mentioned, infection prevention and control teams, numerous mechanisms to understand all the different aspects. Ultimately, it was the staffing crisis that was pre-existing and amplified by COVID-19 that is a serious factor in what has happened to our homes and how quickly our homes decline in conditions once they're in a crisis mode with COVID. And as the Premier said, COVID has really changed things, and that's why we made changes and used emergency orders to speed up our processes. And one of the most recent emergency orders included if there's only one case of COVID-19. And that had to be done because we had to move quickly. So around the world, all countries are learning about COVID-19 and the impact that it's having, and devastating impact on our long-term care homes. Our inspections have been ongoing, and as I said, the change to the RQI and why that was diminished, that was related to the previous government in 2016 and the Auditor General's report at that time.
I just want to make one more comment. It's COVID related, but it's not long-term care. I've been getting a lot of calls about saying, you know, if I go get tested, I'm asymptomatic, I have no symptoms at all, do I have to self-quarantine? And I've talked to the doctors, and they're telling me no. You do have to self-quarantine. If you have symptoms, you get tested, obviously you have to self-quarantine. So I don't want people to shy away from getting tested thinking that they have to self-isolate if they're asymptomatic, meaning that you have no symptoms at all. So if you have no symptoms, you feel you've been around groups, you feel you're nervous that you might have COVID, and please go get tested. If you aren't showing symptoms, you're asymptomatic, you can go right back to work, you can continue on with your life, and please get tested. And I want to thank everyone. The lineups were great right across this province. So please go get tested. Thank you.